Hello and welcome everyone. Thank you so much for the opportunity to share the important work that Ontario Health and the
Merci
Ontario...
tout le monde.
Sorry?
Please go ahead, Carol.
I've started, Gracia.
I think that was the translation, but please go ahead.
Oh, sorry about that. Okay. Sorry, everyone. Thank you so much for the opportunity to share the important work that Ontario Health and the Ontario Quality Standards Advisory Committee are doing to develop a quality standard for sickle cell disease and guide evidence-based care for people with sickle cell disease. Next slide. I have no financial sponsors to disclose.
Good morning, everyone, and I'm Gracie Mabaya, and as Ms. Lonray kindly introduced me, I am also a lead with Carol in the Clinical and Quality Standards Program at Ontario Health, and I have no relationship with financial sponsors to disclose. And so Carol and I have been co-leading the development of the sickle cell disease quality standard. So in order to support this work, a diverse group of clinical experts and individuals with lived experience from across Ontario were invited to form the Quality Standard Advisory Committee. And this committee is co-chaired by Dr. Isaac Adami, Ms. Serena Thompson, and Dr. Madeline Verosek. For more information on the committee, please feel free to visit our website via the embedded QR code on the slide. So why do we need a provincial quality standard for sickle cell disease? We know that approximately 3,500 people in Ontario and about 6,500 in Canada are living with sickle cell disease. And with increasing immigration from countries with a high sickle cell disease prevalence and new births in Canada from parents carrying the sickle cell trait, these numbers are expected to increase. In Ontario and across Canada, sickle cell disease mostly affects racialized people, particularly those who identify as Black. And these people often experience racism and anti-Black racism in their interactions with the healthcare system, which negatively impact the quality of healthcare that is provided to them. We also know that living in stressful social and economic conditions can impact the overall health and well-being of people that are living with sickle cell disease. And these stressors include social stigma, discrimination, and inadequate access to education, employment, income, and housing. A recent review of Ontario data from 2007 to 2017 showed that about 40% of patients with sickle cell disease lived in neighborhoods with the lowest income. We also know that people that are living in rural, remote, and northern communities can face additional challenges to accessing comprehensive care that is often required for sickle cell disease in comparison to their urban peers. And these geographic barriers, which include the time and financial resources that are required to travel to large urban centers and hospitals, can further worsen the continuity of care. So guided by this knowledge and the experiences of people with sickle cell disease across Ontario, Ontario Health set out to develop a quality standard highlighting what high quality care should look like for people with sickle cell disease. So quality standards are meant to inform clinicians and patients of what quality care looks like. And they really focus on conditions or processes where there are large variations in how care is delivered, or where there are gaps between the care that is provided in Ontario and the care that patients should be receiving. They include a smaller set of high impact statements, about 5 to 15, describing optimal care where identified quality gaps exist in Ontario. They are grounded in the best available evidence, and throughout the development process, we apply a health equity lens. So the Sickle Cell Disease Quality Standard aligns with the goals of the Black Health Plan, which is a living document that came out of the Black Health Working Group. This document received input from various people that are working to advance Black health, and it really came out of the inequities that were created by the COVID-19 pandemic. But we know that its importance stems beyond COVID-19 response efforts, as the gaps and barriers that were identified long preceded the pandemic. So this plan has 3 pillars, which are equitable pandemic response, equitable system recovery, and sustained health equity. And so the plan lays out recommendations for the Ministry of Health, Ontario Health, and care providers more broadly. And a quality standard on sickle cell disease definitely strengthens Ontario's health commitment to Black health, and through collaborations with the Black Health Plan Working Group, it furthers the goals of Ontario Health's equity, inclusion, diversity, and anti-Black racism framework, which you may access by accessing the embedded QR code if you're interested. So I will now pass on the floor to Carol, who will speak to us about the scope of this quality standard.
Thanks so much, Gracia. So the scope of this quality standard addresses care for children, young people, and adults with sickle cell disease. It also addresses the needs of families and caregivers and other substitute decision makers where appropriate. So the scope includes screening for and prevention of complications. It includes the assessment and management of acute and chronic complications, and the use of disease-modifying therapies. It applies to all pediatric and adult healthcare settings relevant to sickle cell disease, including hospitals, emergency departments, urgent care clinics, primary care, specialist care, and home and community care settings. So as you can see, the scope of the standard is very broad. This standard includes 8 quality statements that describe how to provide high quality care for people with sickle cell disease. The topic areas listed here were prioritized by our advisory committee as key areas for improvement in Ontario. So included in this list of topic areas are: number 1, racism and anti-Black racism. Statement 2 covers comprehensive health assessment and care plan. Quality Statement 3 addresses vaso-occlusive acute pain episodes. Number 4 addresses life-threatening acute complications. Number 5, chronic complications of sickle cell disease. Number 6 addresses referrals to healthcare professionals with expertise in chronic pain caused by sickle cell disease. Number 7 addresses psychosocial information and support. And number 5 addresses transitions from youth to adult healthcare settings. So these are the topic areas included in the quality standard. So the next couple of slides will highlight how we will measure successful implementation of this quality standard. The Quality Standard Advisory Committee has identified a set of overarching goals for this quality standard. And what we mean by this is how we will measure progress and success of implementing the quality standard. These have been mapped to indicators that may be used to assess quality of care provincially. So those are the indicators listed in the first list. And these are indicators that are currently available provincially. And they cover things like percentage of people who visit the emergency department, things like repeat visits to emergency department within 30 days, and just to give you a sense of what those provincial data would be. It also includes locally collected data, and these are measures that we heard for our committee that were very important and should be tracked, but aren't currently measured provincially. So we've developed some local measures, which would mean it would be up to each hospital or organization to collect information to measure that local data. So examples of these are percentage of people who report an improvement in their quality of life, and the percentage of people with sickle cell disease who report being satisfied with their interaction with their healthcare provider. So this standard will use data and analytics to support and monitor quality and system improvement for people with sickle cell disease. And this is, we're doing additional work for this quality standard to work with a data and analytics team that will develop a cohort of people with sickle cell disease in Ontario to track implementation progress at a system level using quality indicators outlined in the sickle cell disease quality standards. So that's some of those provincial indicators that I mentioned earlier. So we'll use linked administrative databases to develop a sickle cell disease cohort and update it on a routine basis. We'll track indicators at the system, regional, and hospital level via regular reporting. And we'll look to adopt a feedback mechanism via Ontario Health Regions to work with hospitals to drive performance. And further, we are looking to explore the ability to embed elements of the quality statements and the quality standard and its indicators into Ontario Health agreements with sickle cell disease clinics or centers of excellence. And in addition to using data and analytics, we've also taken a collaborative approach to the development and planning, dissemination, and implementation of this quality standard. So we've worked really closely with sickle cell disease partners like SCAGO and Sickle Cell Association of Ontario, as well as other partners across the region and sectors. We've sought public feedback on the draft quality standard through various means. So we put out a broad survey across the province to get feedback on early drafts of the quality standard. We held a town hall led by SCAGO to get feedback on the draft quality statement. And then we ran smaller discussion groups in collaboration with SCAO, again, to get feedback on the earlier drafts of the quality statement. As well, our advisory committee, we invited a broad and diverse group from across Ontario to our advisory committee. So we have 27 members, as Gracia mentioned. 8 of those members are people with lived experience. And for the first time on our quality standards, we've had a person with lived experience as a co-chair of our committee. So next steps. We're getting close to the end of the quality standard. We've completed public feedback. We've shared that back to our advisory committee. We're making revisions to the quality standard. We'll go through some internal review processes, some medical editing through the months of October and November. Later in November, we'll get approval through our Ontario Quality Standards Committee. That's our approving body. And then our aim is to launch the quality standard in January 2023. And that's when our work really will get going. So we are doing a lot of work right now with our partners and with our committee to formulate plans for dissemination and implementation of the quality standard. Thank you so much. And I guess I'll pass it back to Laurie for any questions.
Thank you very much, Carol and Gracia, for that presentation and the work that your committee is doing to really support standard care for sickle cell disease. So I just put it in the chat box, folks, that if you have any questions, please put it in the chat box or in the Q&A. In the meantime, while we're looking forward to your questions, I have 1 or 2 questions for Gracia and Carol. So my first question would be, and either yourself, Gracia, or Carol can take this question. What type of evidence did Ontario Health use to develop this quality standard? Thank you.
Thank you, Ms. Laurie. Maybe I can take that question. So that's a really good question. So to develop quality standards, we typically use clinical practice guidelines as our really main source of scientific evidence, as well as health technology assessments, where they're available And in addition, we also value the input of our advisory committee members, so the clinical experts, as well as the individuals with lived experience as a really key source also of evidence and also experience. As well, as Carol mentioned, we do seek feedback from various stakeholder groups through our public consultation, as well as other engagements.
Thank you very much. Next question. What plans are in place for the dissemination and implementation of these quality standards?
Thank you, Ms. Lonray. I can take that question if you like, Gracia. So Ontario Health is undergoing, now that we have a draft of the quality standard, we're going through dissemination and implementation planning with our committee at this time. We've also been doing a lot of engagements with beyond our advisory committee with system partners and the regions to develop an implementation plan. So that's the work that's currently undergoing. When the standards launch, we will do dissemination activities. So through social media, we'll be sharing it through Twitter to get the word out, and as well, we plan webinars throughout the province to get the word out about the quality standard, and as an opportunity to share with healthcare providers across the province. Through our committee members, we'll also support them to share the standard with their peers, their organizations, through attending meetings. We'll work with our lived experience advisors to develop, we're talking about what other types of social media or videos or things that we can get out to get the word out about the quality standard. And we're also working a lot to leverage priority agreements and accountabilities for the funded sickle cell disease centers, acute care and primary care to embed the quality standards into their practice.
Thank you. There's a question in the Q&A, but before I send that question to you to answer, I want to ask you, because as at this moment, even despite all the work that's been done by Sickle across the province and with the clinicians, there are still quite a number of hospitals that are not following a set of guidelines and so on. We have, for instance, the guidelines that is put together by KENHIM. We have the clinical the clinical handbook on vaso-occlusive standards put together by the Ministry of Health, and yet we still have patients who showing up in some emergency rooms, and the emergency rooms are saying, well, we don't follow that quality standard. We don't follow that guideline. How are you going to hold healthcare providers accountable in this province to ensure that these quality standards are something that they know and they use? Thank you.
So, Ms. Lonray, I can speak to that, and Gracia, speak up if you have anything. So that's where we have tables within Ontario Health, so where there are emergency department leads. So right now, a lot of our engagement is working with them, sharing the work that we're doing, and seeing where there's opportunities to leverage order sets within, how can we look to bring order sets into emergency departments so that people are getting standard of care across the province. So that's the work, and we'll be looking to our advisory committee as well, who work in these different sectors to help us share the work and work with agreements and accountabilities through these funded centers, so that these standards become embedded within the clinical care within the system.
Yeah, maybe if I may just add, yes, thank you, Carol, for that. And as well, this is a quality standard that is being set up by a provincial body. And really the hope is we've embedded what is included in the clinical practice guidelines as the best source of evidence. And so our hope is really that this will be used across Ontario to ensure that there is the standard is applied, the standard of care is applied throughout.
We thank you very much for answering that question so eloquently. We have a question right here. For your feedback system, do you plan to include a reporting system in case individuals with sickle cell disease experience negative interactions in the healthcare system. How do you plan to follow up on these cases? Thank you.
Now, maybe I can start and then you can add anything if I have missed anything. So right now we do have a quality statement on racism and anti-Black racism. And within that quality statement, we've included statement-specific indicators where organizations can really track how they're doing in ensuring that people with sickle cell disease receive care from a system and providers that are free from racism and anti-Black racism. And in addition, within the patient guide, we've also highlighted, for patients with sickle cell disease to ask their care team, where they could go within the specific organizations in case they experience negative experiences. So we're really looking to individual organizations to ensure that there's a safe place for patients to go to express any concerns if they've had any negative experiences. So provincially, I right now, I don't think there is a way for us to track that, but locally within each organization, we've set that up.
Thank you very much. There's supposed to be somebody raising their hand. Can they be on mute to ask their question quickly? We have about 1 minute more before we close this session. Can someone unmute them?
I think there is someone, Sanjeev Luthra, who has raised their hand.
Yes, can we unmute Sanjeev? Can we unmute him, please? Thank you.
Yeah.
They've put their hand down.
Yeah,
they've put the hand down. Okay, thank you very much. And it's a well-attended session this morning. Thank you so much, Carol and Gracia from Ontario Health, for your time this morning. And on this note, we will close this session, and we hope to see everyone at the next session, which is the keynote address, Bridging the Health Equity Gap in Canada. Thank you very much.
Thank you very much.
Thanks so much.
Thank you. See you at the next session, everyone.
Bye.
Bye-bye.